webinar. I wish to start today's webinar with a quote from Eduardo Galeano's Mirror, Stories of Almost Everyone. He wrote, and I quote, "After drought came flood, the rocks groaned, the trees howled. The yellow river, still nameless, swallowed people and crops, drowned valleys and mountains. You, the lame god, came to rescue the world. Hobbling along, you ventured into the flood, and with a shovel opened canals and tunnels to drain the furious waters. Assisted by a fish that knew the river's secret, and by a dragon that went first and deflected the current with its tail, and by a tortoise that went last and carried away all the mud." This quote sort of summarizes the critical role communities play in helping better manage any crisis and shaping public health response, and what happens in the absence of it. In the current times of COVID, community engagement is a pivotal cornerstone for successful management of the COVID crisis. However, building trust, designing and implementing policies which are responsive to the community needs is an arduous task. The intention of today's webinar is to create a safe space for open dialogue on some of these critical aspects that would hopefully help us to better understand the ground needs and the current gaps. Before we begin today's webinar, I wish to thank my team here. I wish to thank Hina, Shuli, Sara, and Yukti from India Alliance and THSTI for their contribution and efforts in helping us putting this webinar together. I also sort of wish to run us through some of the housekeeping rules. A quick reminder that this webinar would be recorded and shared widely. At any point of time, if you have questions, please use the question box to submit your questions. The panelists are providing their views on the current situation as experts and are not speaking on behalf of the government or associated organizations. Having said that, I would quickly want to introduce some of our panelists today. I'm very happy to introduce the panelists who bring to us diverse experiences of engaging communities and in real sense empowering those at the margins. Today we have with us Meena Sheshu. Meena is the founder and secretary general of Sampada Gramin Mahila Sanstha, Sangram, which is an HIV/AIDS prevention treatment support organization working with socially marginalized populations in the state of Maharashtra. Sangram works closely with sex workers and vulnerable populations at risk of HIV/AIDS infection to improve their health, build their capacity to negotiate for safer sex, and support them in asserting and defending their rights. Our second speaker today is Vivek Anand. Vivek is the Chief Executive Officer of the Humsafar Trust, which works on which works with LGBTQ communities. Humsafar works on HIV prevention, care, support, and treatment, research, capacity building, and advocacy. We also have Yevit joining us from South Africa. Yevit is a leading HIV activist and advocate. She's a trusted, global renowned advocate on effective and efficient education of the community regarding new and developing research for medications that treat and prevent HIV. As a woman who has been living with the virus for over 19 years, she has experienced firsthand what HIV stigma, insufficient prevention, education, and reduced access to healthcare can do, and has been advocating for policies to improve the health outcomes for young women and girls. And our last speaker today is Prashanth. Prashanth is a medical doctor and a public health researcher with research interests in health inequities, particularly tribal health. He's been working on determining the social determinants of health, OneHealth, and mental health in primary health care. He has set up a public health research field station in the BRT Tiger Reserve in southern Karnataka, and his work involves examining health inequities in indigenous communities in multiple remote forested locations in southern, central, and northeastern India. A very, very warm welcome to our panelists today. And before we invite our speakers, we do want to hear something from our participants today. And here we have a very quick question, a poll which some of the participants can take. The poll is right on your screen, and we give you a 5 seconds to probably take this poll and document your responses. So we wanted to understand from you, community engagement is critical but often remains an act of tokenism, and want to hear what you guys think about it. I'm going to leave the poll open for another 30 seconds. Thank you so much. So 86% of our attendees today believe that community engagement is critical but remains an act of tokenism. And I'm very, very glad to bring in Meena to sort of, on that note, help us understand why is community engagement so critical. And also, Meena, use this opportunity to help us understand some of the unique healthcare challenges that sex workers are facing in this time of crisis. Over to you, Meena.
Webinar. I'm just going to put on my PowerPoint. 1 second. Yeah, can everyone see that? Hello?
Yes, we can.
Hello? And you can hear me too, right?
Yeah, we can.
Yes.
Thank you so much. Yeah. Hi, here I'm speaking from the National Network of Sex Workers India and the Sex Workers and Allies South Asia, SWASA. The organization I work with is Sangram, and we work with collectives of sex workers. One is Veshya Anyay Mukti Parishad, which is a female sex workers collective, and Muskan, which is a male and transgender workers collective, sex workers collective. So first, let me just get into what is sex work, because I'm so tired of hearing commercial sex workers, and I always say, why not commercial doctors and commercial social workers like me? So what is sex work? We believe that sex work is the provision of sexual services in cash or in kind by consenting adults. This is very, very important to understand that we are talking about adults. We do not believe from the South Asian region that women sell sex, or men or TG people who are in sex work sell sex, or they're selling bodies. We don't have this construct. It's called dhanda or business in our region. And we believe that if a sexual service is provided to the client, it is provided directly as an independent worker or through third parties. Now, the sex work is a livelihood option for sex workers, so please don't forget that. And they are the primary income generators. They create financial assets. They're able to give a decent living, a sustainable, decent living for themselves and their families. There's always this huge conflation of sex work and trafficking. I'm not going there, but the problem is that due to that conflation, all women in sex work are considered as victims, and they're, of exploitation, slavery, servitude. Unfortunately, what is happening is that sex workers who are providing sexual services of their own volition, their voice is blocked, and they're not able to take part in any debate around sex work as victims of sex work. We believe, of course, that as sex providers or service providers, we can unionize, we can work for our welfare, and it's very, very important to understand who is a sex worker. So most of the workers that we work with today are working through their mobile phones or through peer networks or on the streets. The ones in the brothels are actually very, very few compared to the ones on the streets. They work as independent workers or through third parties, or we call them client procurers. Who are they? They're females in sex work. They're always, remember that most of these people are servicing men. They're in the brothels. They're on the streets. From the streets, they go into lodges or hotel-based sex work. We have trans people who provide sexual services to men. These are also mostly street-based. We have some in the brothels, though, and working on the highways. Male sex workers are also people who provide services to men. There is a negligent amount of male sex workers who provide services to women, but this is very, very, very upper class and extremely expensive. They're also street-based, home-based, and lodge-based, sometimes on the highways. What are the issues that this pandemic, we already had issues, many of them, but the pandemic has magnified a whole lot of them. One is what has the pandemic brought up? The hidden nature of work. People were working from home. They were soliciting through mobile phones, and they were renting rooms for the purpose. All of this, because of this lockdown, of course, has totally stopped. The other level, the other group that we have is a large percentage of them are housewives and male sex workers who are husbands. And their families, of course, have no idea that they do sex work. So the other ones that, that are visible in the brothels who you've seen in Bollywood all the time, Kamatipura especially, they've been done to death. But the truth is that a large number of workers actually are invisible workers. They live in a very criminalized existence. The ones that are on the streets or in the brothels, they're raided, rescued, and this is done by both state and society. There are a lot of people who are abolitionists, anti-sex worker rights, and they believe that the only way you can actually deal with sex work is to raid, rescue, and remove people who are in sex work, especially women in sex work. Lots of police violence because of that. But don't forget that violence also happens in personal spaces with intimate partners, and especially where this is normalized as punishment for having sex with other men. We've seen a lot of abuse. When people don't bring money during this period, that becomes a big issue. And then the state, of course, creates more violence because it does not consider these families as family units because they're not traditionally married with their partners. And as a result, most of these are outside the law. The undocumented migrant issue. This is especially now when everybody is demanding that you need ration cards, you need citizenship papers for anything that the government is doling out during the lockdown. We realize that if you're an undocumented migrant, there is no way that you have any right to anything. You can maximum beg for some information or some grocery or some money, but there is no right in it. We also have the problem that if you're undocumented migrants, normally also, nobody is going to give you any loans. There is no access to financial institution. And if there is at all, it is private money lenders. So there are such high interest rates. Today, during the lockdown, when people are not earning, the private money lenders are having a field's day because they are able to then tell the sex workers, when you start earning, you pay, but they're compound interest and sometimes on a weekly and a monthly basis. They also have tremendous insecurity because they're living in rented accommodations. Again, now during the lockdown, all the landlords, almost all the landlords have said, the first month they said, fine, don't pay. May, they started increasing the pressure, and now they're saying, leave if you can't pay your rent. All of this, of course, has a huge impact on health. Don't forget mental health. The insecurity creates so many mental health issues. But then sex workers also live with comorbidities, diabetes, hypertension, alcohol dependency, drug dependency. All of this also has a huge impact because access now has become such a big issue. And we also live with a lot of people who are living with HIV. And as immunocompromised patients, they have another level of dependency on the health system, which at this point of time is not really helping them. What is the future for us? The future is very bleak because we know that sex work depends on physical contact. How are we going to avoid and do physical distancing when we work on, in work like sex work? Just like beauty parlors, massage parlors, hairdressing salons, spas, even the medical profession. These group of people who work with people, they are going to face the brunt of COVID-19. And their work is going to be gravely affected. What we demand is state recognition. The government has to take decisive steps. Otherwise, there is absolutely no way that this community is going to weather the COVID-19. They must show sensitivity. Relief measures can only be, of some help for NGOs, very short term. Government has to come in. We demand that the government accept us as workers. And therefore, we can get the necessary assistance. And of course, don't even talk about undocumented migrant workers because no government is willing to acknowledge them. These are just photographs of the sex workers from the National Network of Sex Workers. They surveyed the communities, they did the packaging, they did transport, distribution, and 5,000 sex workers across these 8 states were actually personally sex workers went and did relief work with them. We need the state to recognize this relief work also. We need the state to involve them in all future work undertaken by the government. Sex workers demand that we are given the status of workers. Laingik Shramik, we're calling them in Marathi and Hindi. And we demand this. And we will continue to do this in the future. So social perception has to change. We have to accept these workers as an integral part of our society, and the sexual service they provide actually is an essential service. Thank you very much for listening to me. I'm open for questions. Thank you.
Thank you so much, Meena, for sticking to your exact 10-minute time. We're going to take questions in some time. I would like to invite Vivek now to sort of help us understand some of the unique healthcare challenges that COVID-19 has thrown for the LGBTQ community, and also help us understand some of the lessons in community engagement and how can we meaningfully engage community. From your past experience, if there is something that you can share with us.
First of all, let me thank you, Devi, for giving us an opportunity to come here. This is probably the second time that I'm speaking on a webinar. Unfortunately, what has happened is that in this pandemic, in the larger narrative, LGBTQI has been totally invisibilized. Nobody wants to talk about them. It's almost like we've gone back 30 years in time. We have become non-existent. Okay. We have to understand one thing, that one, we need to be part of the larger narrative. We need to be seen. We need to be talked about. What we see right now in our communities, and Humsafar has been running a relief fund, and believe me, that was not our expertise at all. But when it came to that situation, we decided to go with it. We have to understand one thing, that like the rest of the population, more than 70% of LGBTQ communities live in the lower socioeconomic strata of society. They do not have privileges. Okay, there are class issues over there. So, like normally, people consider that, oh, like being gay is very fashionable and privileged people. No, that's not. 70% of them are not. So we need to look at the larger population. What do we see right now? When I talk about healthcare issues, my first concern, it begins is it's starvation, it's hunger, it's lack of livelihood. The most impacted of the LGBTQ communities are the trans communities, who either did Mangti or they did Badhai or they did sex work. It's just gone away from them. Okay, there are trans communities, especially the Hijra communities. You'll find 8 or 10 of them, 12 of them living in one room. So what kind of social distancing are we expecting them to follow? And this in itself, for me, is a major healthcare issue, that hundreds and thousands of people out there are dying of starvation, and we are not talking about it. There is some government relief. Honestly, when we started our relief fund, to date, we have not been able to register more than 150 people, the kind of documentation that is required. And when their relief will come is something we don't know. We run our own relief fund. Okay. So that is kind of a major issue. The second issue that has come in is the issue of violence. Now, today, if you are LGBTQ, now that is across the spectrum, across classes, you are left alone with your families. Your families have not accepted you as gay. You cannot express yourself. You are facing violence. You cannot express your gender. Like one of my kids, my advocacy officer herself, who identified as a trans woman, I took her on a team meeting with one of our agencies, and believe me, it was like a jolt to me that she couldn't introduce herself. So the other team member had to introduce her that she identifies as trans, because right now she's sitting with her family. So if she opens her mouth, there's violence coming her way. You know, you can't talk about it. Parents are using this pandemic as an opportunity to so-called straighten out their kids. You know that abhi time aaya hai, ab tum log theek ho jao. Now the violence that we are facing in the family is a huge issue. Mental health has become a huge issue. Now, I am gay, I'm single, I live alone. At least, you know, I have a friend circle. I have a network of friends, a social network. I can talk to my friends. I can call my friends. But hundreds of people out there, thousands of people have no support. They have nobody to talk to reach out to them. Whom do they talk to? So it's taking a toll. So mental health. So right now we have like a team of 3 mental health counselors continuously reaching out, talking to them. And the one thing we tell people is that give vent. You know, try to talk to your friend, whoever you can speak with, talk on the phone. If I believe that I'm a woman and I'm a trans woman, but I'm forced to live as a man every day, 24/7, it's a torture, and that's taking its toll on me. Hormone treatment for trans communities is becoming such a big issue. I know people around me who underwent their sexual reassignment surgery, and today they are facing serious health problems. One of my team members had started bleeding profusely about 2 weeks ago, and it took us some time to get her some kind of medical help. You know, she's lost almost, I think, about 10 to 15 kgs of weight. So what happens to their treatment? Who's going to look into their needs? And most importantly, what happens to gay men, MSM, trans women, female sex workers, all the marginalized groups who are living with HIV? Today, we find it difficult. So we keep finding a way out, how to reach out their ART treatment to them. But access to treatment is becoming more and more difficult. Though there is support, like, you know, the government says, okay, you can go to any treatment center, you can access. How do people go to the ART center? Do they even have that kind of money to reach their ART center? How are we going to ensure that they have access? So these are a few healthcare challenges that I have discussed with you. Also, I'll go to my learnings. I've been working for over 25 years, and I'm surprised that 80% people felt that community engagement is 20%. I think it's probably come down to 2 or 3% or 5%, if I'm being very generous. Because what we learned in the epidemic, and I've been working since 1995, we are country's first program to work with gay men and transgender. I have seen an era in HIV when there was something called community engagement. It is proven, this is 25 years of track record. When you look at marginalized groups, whenever community ownership has taken place, whether it was MSM, transgenders, female sex workers, drug users, the community ownership has strengthened the HIV movement. And I see parallels between what I saw 25, 30 years ago and what I'm seeing today. I see the pattern repeating itself. Today, we do not even have the right estimates of the number of corona positive cases in the country. Are we testing enough? I'm not very sure. I think we are still, you know, sitting on a tip of an iceberg which is about to explode. But there is something called community ownership. There is something called increasing testing. There is something called having right estimate. Do we even have the right amount of kits? These were the challenges that we faced earlier in the day. Were there kits for HIV positive people? Was there treatment? Here we are waiting for treatment. But our earliest challenge was, is there any kind of, people wouldn't come for an HIV test because they would say, if I get tested for HIV, I will die out of fear. Here, we are in the same scenario. You look at stigma today. I think the kind of stigma that HIV brought into the world, the coronavirus stigma is probably 5 times more than that. Because there is this whole fear of the unknown that today, if, like, you are walking on the road, if someone accidentally touches you, you get scared. These are the levels of fear, and we've started taking those stands. Don't come near me, don't come. We live out of fear. People are hiding their corona positive status. I know there have been deaths where family members have refused to acknowledge because they were worried that if they speak the truth, the entire neighborhood would be contained. That that area will be sealed. So that's like a huge thing. Again, one of the learnings what we saw in HIV, one was community ownership. Unless you start strengthening engagement with communities, you will not be able to manage. 2, what kind of partnerships are we building with the healthcare delivery systems of the country? After all, it's a pandemic. Okay. Very honestly, I have little faith in the private healthcare delivery. One of my boys recently went to a diagnostic center to get a corona test and he paid 4,500 rupees for a test. We have to rely on the government. We have to rely on partnerships with public healthcare delivery. We have to kind of, see that how we can make our governments our partners in this effort, how they take ownership. Today, the way it's progressing, it needs to be assessed because corona is not going away soon. Like HIV, today the burden of HIV is much more higher. Okay, it's not going away. If you think HIV is eliminated, we are fooling ourselves. In corona, till such time we find treatment, we will have to keep working on it. We'll have to get governments involved. We have to get public healthcare delivery involved, and community ownership has to come in. These are my thoughts. Thank you so much.
Thanks a lot, Vivek, for touching on those really pertinent points. I'm going to bring in Yevit as well. Yevit, you've been working as an HIV advocate for a long time now, and you know that the role that HIV advocacy has played in providing a center stage to the communities. Vivek briefly spoke about it. I want to sort of hear from you that, HIV advocacy did play a critical role in providing that space to the communities to come to the center stage and not just voice their concerns, but sort of become active stakeholders in research. A lot of honest engagement has gone in bringing that change. And COVID-19 definitely has benefited from some of those experiences, but at the same time has challenged some of the previous experiences. At this stage, what do you think needs to be done more actively to ensure that the ethical standards of engaging communities are maintained and can be enhanced further? And also, if you could use this opportunity to bring to light some of the concerns of people living with HIV at this current moment.
Okay, thank you so much, Devi. My name is Yvette Raphael and I'm from South Africa. Executive Director of the organization Advocates for the Prevention of HIV and AIDS, and like you say, have been part of this fight for over around 20 years. Let's just say 20 years. And thank you so much for inviting me to this session, because I think it's a beginning, and it's also important that advocates around the world start having a global movement. So what I can see with our engagement today and with other webinars is that important movement, because advocates always have to fight. The minute, and I heard that from, is it Mina? Yes, Mina and Vivek earlier on with regards to the advocacy and how far we think we've come. And one thing that I would say, comrades, we are still fighting. So thank you so much to the both of them for their introduction. One of the big things is that people living with HIV depend so heavily on the public healthcare systems globally. So when COVID-19 came in the picture and we had to deal with issues around lockdowns, did we not expect it to be an easy thing? When I started seeing patterns as an activist around lockdowns in France, lockdowns in the US, immediately did I think about my community, which is people living with HIV, around how are we going to do this with a lockdown in place? How will the people living with HIV, as many as 8.4 million in South Africa, access treatment with a militarized system? So with lockdowns came this the policing of people, and I think Mina mentioned that movement has become very, very difficult. So how people are able to access their medication, and we know our governments are poor. We know, unlike private healthcare, where people living with HIV can ask for 10 or for 10 months, up to 10 months worth of treatment, it is not the same everywhere in all communities. So for me, one of the biggest challenges for people living with HIV is going to be the ability to stay on their treatment during this time. And one of the other things is majority of people living with HIV are poor. And if you are not able to move around, and people think the lockdown is, we all can go and panic buy groceries and get it into our houses. Unfortunately, some people living with HIV live from hand to mouth. So everyday movement, and every day somebody has to go out to go and ensure their families or they have access to food. So the challenges is obviously hunger, access to medication, and also when we talk about how these lockdowns operate, it's also very people feel trapped. You know, people living with HIV will obviously feel trapped. We don't, many of our communities don't have the luxury of Zoom calls, webinars, Facebook Lives, and all of that. And as some of the previous speakers have mentioned, mental health issues is a big, big problem. So how do we ensure and how do we make sure that people living with HIV access those services and are able to deal with them? Our communities are also not a homogeneous community. So when these lockdowns happen, one person say, let's lock down the country from tomorrow, or warned us 5 days ahead. Our communities are not homogeneous. Like I said, there are communities that are on treatment, and there's also the communities who have chosen not to be on treatment, one. And the other thing is there are people who cannot access ARVs. So when we talk about how COVID affects people living with HIV blanketly, to say it does not affect people the same, it is a huge mistake, because we know most of our communities have a vulnerable immune systems. And obviously, if COVID-19 affects your immune system, those people who are not on treatment would be affected differently. Now you add a little bit more and you add the issue of no food and hunger in there, and you would see that this can be a disaster. And when we talk about people vulnerable of COVID-19, we should not, it should not be okay that governments do not emphasize the issue around people living with HIV. When it comes to community engagement, I'm one person, and I think the comrades who spoke previously are on my side. There's no way we cannot, we should trust our governments in their intentions, right? The intentions is not for the poor. One of the things is that it's also important for us not to fall for this big trap that our governments learned from HIV and AIDS. The only people who are learning, Vivek, is myself and you and Mina, to say we will not let what happened before happen again. And we know when we see those mistakes and the gaps happening. So community engagement from my side and for people living with HIV has always been a fight. We come to the table very clear that this is an opportunity for us to be seen as stakeholders. Meanwhile, other people around the table only see us as fighters. You know, how when is Yvette going to make a protest? And that is not what it is. If our governments had taken the lessons from HIV into account, governments, policymakers, and scientists, we would not see this mess that's happening. You just have to turn on CNN to realize that we are in a mess. And we are in this mess, it's because communities are not part of the presidential advisory committees or the ministerial advisory committees. There is no communities, otherwise we would have guided them. So it is very, very difficult to manage with this militarized approach. So communities, if communities were involved, we were going to have a sit down to say, we already have these groups in place, we have the structures in place, we can speak to our communities and they would listen, they would wear masks, they will social distance. However, now where we are with COVID-19 is communities who are vulnerable, poor people who are vulnerable, instead of them being empowered by the lessons from HIV, we are sitting in a corner and people are afraid. So they are afraid to go out, they're afraid to access services, they don't know if they have the right documents. Imagine you are in your own country, in your own community, but you need a document to go and buy groceries in some countries. So we are at a point where advocacy and activism has to come again and agitate and remind policymakers there needs to be a place. You know, in South Africa, where activism is so rife and civil society is seen to be progressive, when I mentioned this morning that the biggest issue was communities' absence in these bodies, somebody asked me, who are these communities you're talking about? It means they don't take activism serious anymore. We are not being seen. So when we talk about activism and advocacy, we need to understand that we are stakeholders and we come in with expertise of the communities we come from and the people that we say we represent. So I would like for us to, as we go through this, remember that people living with HIV come with a history, but that history is also not a good one. It's a painful one. So we don't want anybody to repeat it. But the militarization of COVID-19 and the lockdowns has made activism almost impossible in any space and place unless you have Zoom and you can do Facebook Live and you can do WhatsApp. Imagine in communities where people are even afraid to go and ask for their neighbor just to give them a piece of bread or some sugar. And it is possible because our governments have come together and activism is still fragmented. So for me, community engagement is important, Devi. However, community engagement was never a free seat at the table. We were never given that seat. Every time we are talking to scientists with regards to research and community engagement, it's a fight. Every time we talk to our governments around community engagement, it's a fight. And I don't see it any different here during COVID-19 and this process that we all don't know how long it would take. How long will it take for us, one, to get a vaccine, two, to get medication and treatments for this virus, and three, when will this virus just go away and leave us alone? Thank you.
Thank you so much, Eva. Thanks a lot. There's so many points that you covered there, and I think it's a good time to bring in Prashanth. Prashanth, we heard Yevit, we heard Meena, we heard Vivek briefly talking about multiple challenges that vulnerable communities are facing. And at the same time, we also heard about how there is erosion of trust in the public systems that has happened in the recent past. The lack of cultural proximity of healthcare workers and its impact on health-seeking behavior of the community is something that we've seen in the past and it has been well argued. And I want to sort of understand from you, what are some of the unique challenges that you're currently witnessing or foresee with regards to the last mile engagement and ensuring collective community action? And how can we improve health seeking behavior and ensure adequate structural capacity to sort of scaffold any such change? And also, if you could briefly touch upon the challenges of engaging community in research in the light of the current pandemic that we see emerging. Over to you, Prashanth.
Yeah, thanks, Devi. I'm just pulling up my presentation, and I hope it should be up there. So I think I will try and respond to as much of what you asked me to the extent possible. But I'd like to raise some sort of reflections from my practice with work on social determinants of health inequities, primarily in a southern Karnataka tribal population, where we run a public health research field station. And I think, and I come in from a perspective, I'm very aware of the very important issues raised by three speakers before me. My perspective is slightly different, but I share a lot with the other speakers. I'm coming from the perspective of a doctor and a health researcher, but when you're researching health inequalities and when you're researching social determinants of health, it's often very difficult to say that you will remain separate from being an advocate for some of the issues that you are working on. So these roles tend to blend, especially in researchers who work on social determinants of health and health inequities. And community engagement is, as everyone has mentioned, is not new at all. However, it's a very contested space. It has a long history, beginning with the Alma Ata Declaration. India already ingrained, at least on paper, the need for community participation when it subscribed to the primary health care model of health service delivery. Much later, if you see the National Health Mission, earlier the National Rural Health Mission, you had the idea of what they called communitization built very integrally into the principles of the mission. And of course, India has a very long history of civil society awakening in terms of not only social movements, but also exemplary sort of models of community engagement right from the 60s, 70s. There are many wonderful experiences where people have gone into really remote areas and worked very closely with communities. Right now I am in a place called BR Hills, where in the mid 70s, Dr. Sudarshan started his journey of realizing that health is very integrally part of a social awakening and not necessarily only about medicine. And the idea hence of community participation, at least from the health perspective, is strongly rooted in an idea that health is possibly more determined socially than I would say biomedically. The social origins of ill health are very strong, and this too has a long history, not only in India, but also in modern medicine. You have examples of doctors, researchers like Wellcome, who was as well known as an advocate of the social origins of health, as much as he was known for his work on pathology and various aspects of biomedicine. So I think Vivek touched upon this briefly, and people often ask, where is the evidence? Does community engagement work? And things like that. And I think it's very important to remember why we talk of community engagement when we are talking of not only last mile, but in terms of any health services or health systems work. The why matters very much, because it's not about cost effectiveness of programs. It's not about removing barriers or obstacles to achieving your outcome. It's not about greater visibility to the project. In fact, even if it does not work, community engagement has to be integrally built into policies and programs, because that is the way in which any public service ought to be delivered. So it's not so much a question of of why we are doing. It's not so much a question of whether we ought to do it, but a question of why and how. And that's where I think community engagement is distinct from various other principles that we seek evidence for within the research community, at least. I'm sure none of my previous speakers come from a background where they're seeking evidence for whether community engagement matters or not. And working with communities, especially those that you mentioned, be it tribal communities or various other communities that we talk about, there is a huge need for deprofessionalizing our professions itself. So the way we have constructed healthcare delivery, the way we create these professions are inherently, unfortunately, not designed for community engagement. So there is this need to literally get our hands dirty, so to speak, and learn some of these temperaments, some of these skills and competencies that are needed to communitize various services. And obviously, like many speakers hinted quite unambiguously earlier, bureaucracies and systems are also not built to enable community participation automatically. These have to be dialogued, these have to be literally figured out, sometimes through collective action, like the HIV movement has told us. And finally, the biggest barrier, I think, is for preventing community engagement is actually on our side. By ours, I mean health workers, health services, and professionals, because the mindsets and temperaments, again, are not built for community participation. On the right side of this slide, I have I won't go too much into detail on this, but even when we say community engagement, there is a whole spectrum of way in which we can talk about engagement, and there's a whole politics around how we engage communities, and certainly on why we engage communities. One such example that I have put here is this Einstein's ladder. There are various other models to look at, which maps out the essentially how much of power is being shared in our policies or programs. And at the heart of community engagement lies that the ability and the willingness to let go of any kind of power, be it financial, be it other kinds of convening powers and authorities, etc. I think with respect to COVID and community engagement, one very important thing for us to remember is that knowledge does not automatically transform. So we are in this game where we think that passive injection of knowledge to people on how to prevent or protect themselves is automatically going to change behavior. We know from enormous amount of research as well as just common sense that people do not behave. People are not sort of looking for scientific evidence to change their behavior. The way behavior comes about is as much determined by knowledge as it is determined by also the ability and the circumstances in which people find themselves. And often in community engagement, the circumstances in which people find themselves are much more limiting for them to be able to practice desirable behaviors, at least desirable by the authority, so to speak. So I think this is at the heart of understanding community engagement, and this is something that we can only do through dialogue and listening. And the more powerful one is, and I think the more listening one has to do in order to really crack community engagement, because often we are talking of engaging with communities whose experiences we do not fully understand, merely because we have not undergone these experiences ourselves. And that's I think very important. And community engagement is also able to hopefully take us towards more contextually relevant ways of combating this epidemic than these big bang approaches of lockdowns at state or national level. I wish we had strong practice cultures of community engagement, because that would have helped us leverage those platforms and cultures during this epidemic. And I think that's where we have erred, because to a large extent, many of our systems and services are not geared, are not designed for engaging with a very diverse set of stakeholders. Here, I would like to just highlight one point, the second bullet point. I think the romantic notion that community is one, and many speakers talked about it. We are talking of very heterogeneous people. We are talking of communities that are also stratified. Communities also reproduce sometimes our social strata, be it patriarchy, be it adverse gender dynamics, be it caste dynamics. These are also reproduced in communities. So I think community engagement too has to be aware of these kind of stratifications and power hierarchies that are existing within our society. I'm towards the end of my my piece here, and I think what I would like to share, this is an example of what we are trying to do in our work on tribal health, where the idea is really to have transformational knowledge. And I think this addresses the question you posed on what is the role for research in times of COVID-19. And I think the role for research is to realize that knowledge in case it has to be relevant socially, it has to be transformational. And for knowledge to be transformational, the level of engagement and the wide intersectoral nature of engagement is, I think, quite difficult sometimes to be able to be done by one person or one entity. So it really requires a coming together of a bunch of disciplines, of a bunch of people, implementers, and various other people. And there is no scope for experts here, nor is there a scope for, a magic bullet. So I don't think anyone can claim that they are an expert in community engagement, and but one only learns through practice. And that's why I've said moving towards a practice-based evidence rather than an evidence-based practice, which is a phrase that we often hear. I don't know whether I have overshot my time, but I would like to thank a lot of my own learning from community engagement comes from my close association with the District Indigenous Peoples Welfare Society, who are our partners in our work here. I would like to thank them. And I have a blog where I have extensively written about this piece that I have presented in this time.
Thank you so much, Prashanth. You've stuck to your time. And I think these are really wonderful insights that sort of help bring a lot of the discussion together. I'm going to quickly get in our audience probably, and I would like to share the last vote that we took. And this is what the audience today says about community engagement being, whether it is critical but often remains an act of tokenism. And I want to hear again from the audience about one more question, which we've been sort of discussing. What do you think is the role of community engagement during or after an epidemic? This is not an exhaustive list. We had only 5 options, but we really want to hear your thoughts on it. And we have 30 seconds to vote on this. Audience, can you start your voting on this, please? You can choose multiple options in this one. Okay, I'll give you 10 seconds more before we close this. Thank you so much. And here is what the audience has to say about role of community engagement. 64% believe it's to promote collective action, 57% believe it's for strengthening equity, 52% believe it's for behavior change, 70% believe it's to inform communities about risk to their health and well-being, and 59% believe that it's to promote informed decision making. On that note, I'm going to bring back our speakers and take some of the questions that we have here from the audience. So the first question is, are there examples of community engagement activities that any of the panelists about which are being done during this period of physical distancing? Ina, do you want to start with this?
No,
Can I? Hello? Yeah, can I?
If you want to go ahead, please go ahead.
Yeah. So one of the things what we did was on 29th of March this year, we started an emergency COVID relief fund for the most impacted communities. Now what we have done is our teams have been repeatedly trained on what social distancing is. And when they are doing the outreach, the relief outreach work, they are also told to spend a few minutes in the communities when they take rations, that what social distancing is, talk a little about how they can take care of themselves, and that's the only way we can reach out to them. not all of us are privileged enough. We are right now also developing some WhatsApp videos that could be circulated within the communities on understanding the virus better. And we feel that, we can't, like talking is becoming difficult, So at that level, we are trying to engage with our communities directly. And one has to think innovatively, one has to think differently, but one continues to do that.
Thanks, Vivek. Meena, do you want to share some of the efforts that you guys have been taking on the field with respect to community engagement?
Can't hear Meena. Meena, we can't hear you.
Yeah, see, they have to unmute me. Okay, now I'm unmuted. Thanks. Yeah. The organizers. Okay, see, in Feb itself, we realized that this is going to be huge. Also, don't forget, as HIV, essentially activists with the HIV work, a virus was something that the community knew about. So, in fact, one of the first questions was, how does this enter the body? Because that was the question that was asked in HIV, and what do we need to be careful about? So we did small videos just among ourselves as to what we need to do to be careful. We went through the whole hand hygiene story. We knew that social distancing was a joke in the communities that we work with, especially the ones that are in the brothels, because how can you even imagine? I mean, I so agree with you when she says, how can you even imagine social distancing when you're so deeply packed in one room? And when you're living in such close proximity in the open community, that's difficult. But we were very much interested in talking to people about how to take care of themselves, when, because those days the lockdown was not announced yet. And so, for 1 month almost, people were getting the clients to wear masks, to wash their hands, to wash their feet. A lot of people spit in this country. So there's a lot of problem with body fluid on the road, spitting and stuff like that. So that was done. But I think what really was interesting for us was the way the communities rallied around and started giving us surveys. Because we had said, do a survey that was at 3 levels. One is people who need cooked food. One is who can manage with dry rations. And one which doesn't need anything at this point in time. Because then we can, tailor our response accordingly. And actually, across 8 states, we were able to identify through the National Network of Sex Workers, both male, transgender, and female in sex work. We were able to identify them. We were able to get them dry rations, and also, started fighting with the government, with the local municipality, with the social welfare department, with the women and child department, saying, listen, you guys need to give us rations, especially because the women, most of them are undocumented migrants. They don't have citizenship papers. They don't have ration cards. And so how do you advocate with the government to see that these people are, given a chance? And actually, I must say that the government did respond, and we did get special rations for people who did not have ration cards. And that was a huge positive. So, yeah.
Thank you so much. Yevit, do you want to quickly chip in and talk about some of the engagement strategies being applied on ground?
Yes, and just like my previous speakers and panelists, we saw this coming when other countries started lockdowns and what it meant for us and it meant for our work. One of the things that we do is work with young people, HIV positive young people in the communities. So what we needed to do is starting to actually transition them into getting used to WhatsApp communications, and also with Facebook. A lot of young people are with their phones all the time, those who have phones. And we started having calls on a Friday afternoon where we talk everything young people, HIV prevention, and during this lockdown. So it was one of the things we do. We also, as South Africa, have a civil society COVID-19 response. But as my comrades are saying, this is not funded. So we have to fight for money. We have to fight for visibility. We have to fight to be at the table. So there is a community, because we know the community. We know exactly how our communities listen. And I'm grateful for Prashanth to say that big announcements doesn't mean people hear. So when you do big bangs and you expect communities to, just jump and change their behavior and change how they live, it's not important. They would like to hear, like Vivek said, you have to explain to them what does it mean. Nina said we had to start telling them about mask and why do we have to have the mask? Why? This information is around COVID is also so confusing that we have to continuously take away some of the, the fake news and also some of the fear mongering and bring back into the reality how this virus is transmitted. So for us, it's a continuous working with the community, ensuring that they have the right information and checking in with our communities. Like I said, our communities are very poor. Some don't have access to food. It's continuously also risking to go through these channels to go and see if our communities are okay. Thank you.
Thanks, Yvette. Vivek, if you want to chip into that, and also something that audience wants to understand from you is, in your presentation, you mentioned about community ownership. If you can sort of elaborate on what do you mean by community ownership or define community ownership?
Okay, so first, going back on the same point, I think I totally forgot to acknowledge community engagement, and that would be unfair on my part, because when we started this initiative, our communities helped us identify 400 plus LGBTQ communities and allies who were like high net individuals, and we reached out to them to support our relief work. And almost, I'm like very happy, very proud that community people and our allies stood by us, and more than 60% came in and chipped in donations. There are students who donated like 100 rupees, 200 rupees and 500 rupees. But that spirit of community engagement was very much there. Coming to community ownership. Now that, my dear friend, is a subject in itself. But when I talk about community ownership, I look at myself as a gay man who went to a business school. Had it not been for the fact that I'm gay, I would have never been at Humsafar Trust. I would have probably been, probably been a CEO at one of the corporates, multinationals, and looking down at people like me. But my commitment came from the fact that when I was 18 years old, I had nobody in the whole world to talk to. And that meant a lot. And that meant, and my father had once told me that if you want the world to know who you are, it's for you to go out and tell the world. For me, that's community ownership. And when our organization began, there were like initially 3 people, and after that we were like about 6 or 7 people. Everybody is from the LGBTQ community. How the organogram in a community-based organization looks is that your communities are at the top, and then it starts filtering down. Community brings inputs, community tells you what their needs are, and then, as people who are working in the organization, you take cognizance of the fact that what the community needs are, and then you start working towards that. So unless communities get up and say that this is my cause and I am going to work for it, and I am going to come to you and tell you that I exist, and if you don't listen to me, I will come to your door every day. I'll keep coming till you acknowledge my presence. But that's my job. That's community ownership. There is a role of communities, there's a role of stakeholders and the government. But community ownership is very important. I can talk a lot more about it, but I don't want to make it very elaborate.
Thank you so much, Vivek. Thanks a lot. Prashanth, next question is directed at you. The participants asked that during and after a pandemic such as COVID-19, how to work towards a practice-based evidence, which community engagement calls for. And sometime I believe everyone, including policymakers, are part of the community and social constructs. how to work with them to make community engagement an integral process. If you could throw some more light on that.
Yeah, am I audible?
Yes, you are.
Yeah. So I think it's extremely important to first acknowledge reasonable failure, if not an overwhelming failure. I think it's important to see what we will not acknowledge, we will not fix. So I think it's very important to acknowledge that we have, to a large degree, failed to embrace the very diverse set of ideas, people, diverse set of identities that we have in our society. So the first thing is to say that our public services need to be much more inclusive than they are. And only if we have that kind of acknowledgement at all levels will we begin to start thinking of how do we fix it. So I think that's one thing that we need to talk about in a post-COVID restructuring, so to speak. And second is, I think that we need to, I mean, even like the three of my earlier speakers, we need to leverage the rich experience from a widespread civil society engagement on community participation and community engagement that has happened. We don't need to do it uncritically. There have been very problematic engagements by civil society as well. It's not all rosy and beautiful. But I think we need to leverage that experience that exists in non-governmental space and civil society space and bring that into our public services, be it transport, be it health, be it schools. We need these public services to be able to respond to a very diverse set of people, because we are all not the same. We all don't share the same gender identity. We don't share the same aspirations of what we want to do with our lives. And our public services need to be able to cater to that. And for that, we need to start building these kind of learning sites within public services, leveraging inputs from civil society and the non-governmental space. These are two ideas I can offer. But obviously, these are not topics where one person is an expert. These are again scope for all of us to come together and bring our ideas together. There is not going to be one expert at community engagement who can fix the problem, but we all have to do that together.
Right. Thanks for that, Vivek. Prashanth, one of our participants says that I feel that in India we have turned a public health problem into a law and order problem. Any comments from the experts on that, please?
Yeah. Am I unmuted?
Yes,
Yeah.
yes.
Yeah. Okay. Actually, it's true. I agree with whoever's made this comment, because instead of dealing with this, like Yvette said, like Vivek says, involving communities, Prashanth is talking about, community involvement. My point is that government did not take the communities into confidence when they decided to go through this whole mess that has been created. Today, what we see is actually in India a sorry mess. And this is because the government did not think it was important enough to treat this as a public health issue, the pandemic as a public health emergency even, and decided to do it as a law and order issue. Now, what can we do? What can government do to change this? I sincerely believe that the communities have a lot of experience on how to deal with communication to communities, how to deal with access issues, and the government should actually leverage that. Unfortunately, they have this the National Health Mission, they have community-based monitoring projects throughout the country, but still I haven't seen them appealing to these various projects of their own that they run. We have run these huge targeted interventions for the government of Maharashtra with key populations. I'm telling you, they have not appealed to us at any level to come and help resolve things. What they've done is sent the police to beat us up. That's a crazy situation. How do you access antiretroviral treatment if you're not allowed to go to the civil hospital to get it? How do people who are poor actually access nutrition? It is such a big issue. But I'm telling you that this has been an issue of mismanagement by the government. And this is something I'd like to put on record.
Yeah. So
Go ahead, Vivian.
Can I?
Yes, please.
So,
Yes,
you
please.
know, yeah. So we've been talking about the epidemic, the HIV epidemic and coronavirus. Very interestingly, one thing what I saw was that in the HIV epidemic, the movement began at the grassroots levels and it got a thrust upwards. Okay. Earlier we spoke about similarities and lessons learned. Here is what lesson that we did not learn, that in HIV the movement came from grassroots level and had a thrust upwards. In Corona, it's a total top-down approach. It's a complete, I mean, there are times I wonder whether we are living in a state of lockdown or is it a state of emergency? Like I am literally being told every day, the government decides everything. And like Meena said, I hate to use the term migrant. I'm having a problem with that term now because someone who's lived in my city where I was born for 30 years and 30 years later you are still calling him a migrant. That's most unfortunate. And today, if they are leaving us and going away, they are not finding entry in their states, which was supposed to be their home. So which side do they belong? All that they find is violence. You know, did we reach out to them in a systematic manner? How this top-down approach, how come like nobody was even brought into picture? And I'm unfortunately like right now, a lot of things that's happening, even in terms of treatments. And like, I don't know, I can't understand the kind of certain research that is happening in our country particularly. Where are we headed? Where are we going? And whom are we talking to? Are you engaging with communities? Did you talk to anyone? And I'm not saying talk to me or talk to Meena, but where is community engagement? So this is the main difference I find, and I totally agree with whoever raised this question, that HIV was different in the sense that we started at grassroots levels. Here it's a very top-down approach. Everything, every day of my life is being decided by someone up there. And that is going to lead to a law and order problem.
Right. I'm going to bring in Yvette. Yvette, do you want to share something from your experiences?
In all of our experiences with the lockdown, and this goes to our populations, people living with HIV, the LGBTI community, and the sex work community, is this unprecedented militarization around the lockdowns. There was no need for our communities. I think the first videos I saw around what was happening in India, and I was like, there's nothing different happening in South Africa. Our communities are forced to do sit-ups. Imagine if you have asthma and you are told to do frog jumps from wherever you meet a soldier to your house. So this has been the issues that we have to deal with. So how we missed out in our communities to organize, and that community engagement means that our governments were supposed to speak to structures where our communities get information from and involve them in the planning of the lockdowns to explain to them. So I don't think there's much of a difference, and for us to try and pick this up now is going to be difficult because our governments, like you say, Vivek, every day people are making decisions on your behalf. You cannot go to the shop without this. You cannot go to this place without. Actually, we are just in South Africa. We are in a state of emergency, which is also the same. We don't have a space or an opportunity to actually table why these lockdowns are so difficult for our communities to follow, especially when we are in slum areas in the townships of South Africa.
Thanks, Yvette. Thanks. Prashanth, I'm going to come to you, and I'm going to try and understand from you that, you know, it's understood that no marginalized community is homogeneous in any way. How can we incorporate intersectional lens in community engagement? If you have any thoughts on that.
For us, we must always remember that the differences between gender, class, and all of those things, how they intersect with any vulnerable community. So the reminder is every time we engage with community engagement, we have to remember who is the people speaking. So in our governments, and how does this intersect with the community? Unfortunately, when these lockdowns were decided on, it was people speaking from a point of privilege without being checked. A point of what is my most discomfort. Okay, as a politician, I can drive through, I can have a permit, I can have this, but most of our communities do not have access to that. So when we do talk about community engagement, it's important that we remember gender, class, and race when we talk about intersectionality and how it will affect any program. And without those people at the table who are affected by the gender, class, and race, will we not understand how intersectionality works? Because intersectionality is basically this one person who has to deal with a myriad of difficulties and challenges as they navigate through their lives. And if you don't have people who can speak to those challenges, you're only going to make a top-down approach, and it will not suit into the lives of any of the communities that are on this panel today. It will not make sense to us. And most of us are poor, and most of us are people living with HIV, sex workers, gender non-conforming folks. So we understand how this works. Some of us are all three in one, and we know what this would mean to our communities.
Thanks for that, Yvette. Meena, do you want to add to that?
Thank you.
Actually, I mean, it's just so scary for people who are unable to figure out what's going to be the near future. When your work, especially I'm coming from the work of the people I work with, which are sex workers, the future is so scary. And you don't have state investing in trying to even talk to you about your future, knowing what your future is. And how are these communities going to weather this epidemic? I mean, this pandemic is something that is really worrying us. Government, I feel, is more interested in the economic problem and dealing with that, with the issues that they're having at the level of the economy. But I think the communities are being left out of this discussion. And even now it's not late. Government should reach out and talk to communities to see how we can contribute and how the communities can contribute. And like Vivek says, not Meena and Vivek and Yvette and Prashanth, but actually communities. How do you reach out to them? What is the mechanism to reach out to these communities and help them, ask them to help us resolve the issues that we are going to face immediately?
Question basically is that in view of rapid COVID-19 research studies, is community engagement possible? This is in consideration that community involvement does take time.
In fact, that's the worry I have. Suddenly, government may, because the way the government is dealing with everything now is we are being told rather than asked. I'm worried that, the group of sex workers who are available through the targeted interventions may be used for clinical trials, may be used for any kind of research, and they will be told that they'll have to do it for common good. And the point is that they will not be involved in the decision making when this happens. And that is something I'm really worried about. Community engagement is possible. In the fight against HIV, we have seen this clearly. But it requires investment, and it requires that the government actually invests in involving communities and encouraging community engagement. And that is some investment I don't see at this point in time. So that is a difficult question unless we have the large governments and the states over there trying to talk to their communities, their citizens, to encourage community engagement.
I think I also agree with Meena on that, because if governments are talking to each other, if bureaucrats are talking to each other and certain decisions are being made, I fail to understand that why no conversation can happen with the communities. if you are really interested in community engagement, then there are viable options. And like even in these difficult times, we are finding solutions for our problems. We would find ways out to become part of a dialogue if the government was keen to talk to us. The whole issue is there a will to take community engagement, to get into a community engagement, or is there a will that no, like we know the best and this is how we are going to do it?
Yes, I think community engagement is possible because we've done it before. We know how to do the community engagement. However, our governments in this state, the voice of community, the voice of people in countries is not heard because we are unable to do so. So, for instance, we hear results of trials by press releases, we see new medications, then it's toxic, then it's not toxic, because community engagement is not happening and the governments are not following any rule book. They are doing whatever they can as they get along. I know in South Africa there are trials happening for hydrochloroquine. However, in some spaces, we are told it's toxic and it's not. And then we hear the president of another country is on hydroxychloroquine as he pleases. So we are in a danger where in this COVID-19, governments and policymakers and scientists are going for the money. Whoever comes up with the drug first or the vaccine first, and everybody is pushing and scrambling. There were numbers of no future or no even a vision for vaccine. 3 days, 150 studies were registered. Wherever have you heard that? Everybody's rushing to get billions and billions of vaccines that will be tested in our community. Engagement is not going to happen. And we must also be afraid of gatekeepers, community who are gatekeepers who are going to take the sex workers. Need to be vigilant as advocates, activists around this issue because they're not going to invite us to the table. Too much is at stake.
Thanks, David. Thanks for that. Another question that we have from the participants is basically, how do we engage community? So we've spoken a bit about engaging communities using various social media platforms and how you guys have been using videos as tools to engage communities. People want to understand that how do you engage communities where the literacy levels are too poor and it's sort of in media dark regions. What are some of the ways to engage the communities in those areas? Also, if I may just add to that, how to engage rural communities with limited resources, especially when the novel coronavirus demands resource-intensive preventive measures.
See, it has always been a challenge to reach out to hidden populations. It has always been a challenge to reach out to rural population where literacy is a problem, where media is a problem. Okay, but then there are mechanisms that can help you reach out. There are so many, like, you know, apart from your regular media, there are so many other channels that you can reach your messages to people down the line and talk to them and engage with them. There are so many people out there who today may not even be aware that what's hit them. So obviously, even if there is no media, those people are asking questions. If they are asking to questions, is there someone to hear them out? Can that question be pushed upwards and answers be reached out to them? It is a challenge, but it's not an impossible task.
Thanks,
Yeah, and I'd like to come in on this. I think we are missing the bus on. Yeah, I think we are missing the bus on this. Rural communities are extremely aware now. There's TV. How do you think the government is reaching them? They're actually using TV to give them all the wrong messages. That's not the point. The point is that these messages, whatever wrong or right, are reaching these communities. Please don't forget mobile phones. Please don't forget WhatsApps. I mean, the kind of, you realize how much these things are working today because of the wrong messaging that these, that we're hearing. So please do not believe that I work in a rural context. I work only in a rural context. And let me tell you, I don't live in a city. I live in rural India. And I can tell you for sure that every message, actually the wrong ones reach the fastest. And the point is, how do we now use the same messaging platforms to reach these communities? I think that is the challenge, not the fact that the communities are not being reached. I'm telling you, they are being reached. How are we going to use the same platforms to change this messaging, to talk about some kind of resilience from the communities? And how do you make those communities actually use the same methods to reach the higher ups? That is the issue.
Thanks, Meena. Prashanth also shares his view. He has just written to us saying that knowledge, education, and literacy ought not and cannot be barriers to engaging, working with the community. It only means that we're using the wrong methods if we are relying on literacy. I feel we have to learn about engaging with different communities and populations, and we need to reverse their expertise here. I know we are a little over time. I probably will take 2 more minutes, and I want to end this with one last question that I want to understand from you all. We've spoken about multiple challenges that are staring. There's hunger, there's starvation, there's job loss, there's violence. But as we stare at uncertain future with multiple lived realities and people struggling with their day-to-day crisis, especially those who are on the margins, how do we make sure that people pay adequate attention to measures required to manage the COVID crisis? How do we make sure that it remains a priority and doesn't get lost in the day-to-day struggles?
This is, I'm in one relatively remote location where our public health field station is, and these are some of the challenges. While I think the first way to begin is by acknowledging that techno-managerial kind of solutions can only take us so far. Having smart apps and relying over-reliance on big bang high-level technological solutions that are devised by expert groups and think tanks and high-level philanthropy, etc., can only take us so far. We'll continue designing policies and programs that benefit typical or the average. And we are a society where there are a lot of people outside of these averages. And I think if we start relying on decentralized ways and methods of working rather than high-level central programs and techno-managerial solutions, we can get there. And it's not like this has not been done. Many speakers emphasize that there's a huge wealth of experience in a wide network of social movements and civil society organizations, which we need to learn from and bring it into our public services. And that's the only way I see vulnerable and marginal communities joining the mainstream.
Thanks. Others, do you want to join into this conversation?
No, muted. Hi, yes, thanks, Devi. I just want to go back to the point about not finding our communities. Our governments know where to find our communities when it's election time. They must use that same channels the same way. They must use community radio. They must use community TV. They must use everything community that they use to go find our communities for election to reach our community. When it comes to us continuing this work and how do we strengthen the work with regards to COVID-19, it's education, education, and education. Make sure the community healthcare workers that you send out there do have the proper PPE. It's actually criminal for governments to send out community workers into communities with a t-shirt that says COVID-19. It is criminal. it is criminal for them not to give communities the proper PPE to go into this work and do this work. So we need to cascade the levels of the work that we do, and our communities will participate even only if they are feeling part of the solution. Right now, our governments are dealing with our communities as if we are a problem. We have a problem with people who are hungry. We have a problem with people who are homeless. We have a problem with everything instead of using the communities to come up with the solutions for themselves. So I would like to see our governments using our communities and making solutions. And one of the things that we can use for COVID, as we did with HIV, COVID is exposing a lot of inequalities in this world and in our countries. And if we don't use this time to fix those inequalities as activists, we would have failed the people who are going to die during this time. Thank you.
Thanks, David.
Let me come in on that for 1 second. Yeah, I totally agree. I agree with Yvette. I agree with Vivek. I agree with Prashanth. This has been a fantastic experience because it's really brought out that people working in various social sectors have access to these so-called invisible communities. Government now should involve all of us, directly the communities, the social movements, the networks, they all exist. And like you had said, well, if they can reach them during elections, why can't they reach them now? I totally agree with that.
Thanks a lot for this engaging and invigorating discussions. This definitely has, yeah, please go ahead. Please go ahead.
Yeah, no. First of all, she's given me a line that I could use probably for the rest of my life. If they can find them during election times, why not when we need them? They can. So my only thing is that somewhere along the way, and I've seen this happen in front of my eyes, that in the last 2.5, 3 decades, over a period of time, governments are having lesser and lesser faith in its people and its communities. And unless, they start believing that people on the ground are the ones who are going to bring about a change, it could be anyone, it could be any kind of pandemic, it could be any kind of disease. Like, I remember there was this time when we had developed our first set of indicators on how to assess our outreach work in Maharashtra, and we had done that ourselves to a point where we worked with this one of the largest donor agencies who came in and told us, these are the indicators on which we want you to work. Meena would remember that. We were asked to share photographs of sex workers because it was data for them. So we have to realize that I can define what are my measures of indicators. You can bring in resources. It can be a good partnership. But unless governments start having this faith that it's people on the ground who bring about the change and you have to engage with them, the solutions are not coming. Like today, we are in a very sorry state of affairs. You dread putting on the TV. First of all, media itself is in a state of mess. But you then dread putting on the TV that what's happening around you, So unless that dialogue happens and unless that belief comes back that these are our people, they know their job. So please do not totally sideline communities and tell them, okay, we will decide for you. Thank you.
Thanks a lot to our panelists today. This really has been an engaging and an invigorating discussion. I know we have overshot our time, but this definitely has helped open discussions on multiple facets of the community engagement. We do realize that a single webinar can't do justice to this vast topic, but we're very thankful to our speakers today who shared their insights on a breadth of issues with regards to community engagement. And we do hope that this would be a start to a much needed conversation. Once again, I want to give a huge round of thanks to our panelists and participants, and also to co-organizers. Hope you all stay safe and stay healthy. Thanks a lot, everyone. This really has been very
Thank you so much. Thank
Bye.
you.
Bye.
Bye, Meena. Bye, Prashant.